The next question, the member for Thunder Bay Atikokan.
Thank you, Speaker. My question is for the Premier. Speaker, I continue to hear from folks throughout my constituency who are still not getting the pandemic pay this government promised weeks ago. Jean Bartkowiak, the President and CEO of the Thunder Bay Regional Health Science Centre, wrote to the Premier calling for pandemic pay for all our frontline healthcare heroes. As he put it, many of my staff have been working for the last more than 8 months, 7 days a week, sometimes more than 12 hours a day, and the fact that they're still waiting to find out if they even qualify for support is making things harder. Premier, when will this government ensure that frontline healthcare heroes finally get the pandemic pay they deserve?
Deputy Premier.
Thank you. Well, we are grateful for the work that our frontline professionals are doing in healthcare. They are the ones that really are holding up the entire system for us. They are the ones that show up each and every day, and the idea of pandemic pay was to assist them, at least financially in a small way, to thank them for their efforts. But the pandemic pay is being worked on daily. It's important to mention that the Ministry of Health has been working with over 1,000 different transfer payment agreements and getting this moving. So it should start flowing next week. All pandemic pay recipients will receive pay from the date that we first announced it. So it will be retroactive back to April 25th, but it's just the sheer volume and the number of transfer payment agencies that we're dealing with has held this up, but the money will start flowing next week.
The member for Windsor-Tecumseh, supplementary question.
Good morning, Minister. Speaker, when the pandemic pay plan was announced, the government said employers had all been contacted by the 15th of May. People in my riding were expecting money to be in their bank account by now. However, we now know the government has no idea when all employers will be contacted and the money released. We do know there are other employee classifications deserving of the bonus pay, including lab techs taking blood samples, X-ray techs, dialysis techs, staff in our physicians' offices, in pharmacies, physiotherapists, and God bless them, the good people who are handing out the groceries at our food banks, making sure that those in most need don't starve. Speaker, when can we expect the government to show their appreciation to those employee groups I've just mentioned?
Deputy Premier.
Thank you. Thank you very much to the member for the question. And the careful consideration has been given to the recipients of pandemic pay. I know that they are anxious to receive it. However, as I indicated in the previous question, there are over 1,000 transfer patient agreements and agencies that we're dealing with. That is what has held things up slightly. However, the money will start flowing next week. It will be received by the employers for distribution to the employees accordingly. So I know they've had to wait a little bit longer than expected, but that's only because of the sheer volume and the number of transfer payment agencies that are involved with it.
The next